op one, a patient just left. We did an extraction of multiple teeth, and we seated a temporary upper and lower partial. So again, you're going to get all the instruments, gather all the instruments together, put them on your tray, hand pieces. We use 2 hand pieces in the ops where the doctor works. We have a slow hand piece that I just took off. How you would do that is this little piece here pushes back and it goes right on into place. Sorry. And then you just pull back to come off. The other hand piece is a high, fast hand piece. This one here, you just pull off, but before you do that, you want to take the burr out. So you're going to push down on the back here and pull out the burr. Okay? Burrs have its own little area to put back, and it's really hard with these utility gloves on. And you just put it back in your burr. Because this whole burr collector is in the op and it was all exposed to everything we were doing in here, this whole thing is going to go through the sterilization process. Not just that one burr, the whole thing. Okay? Now, on here, we have anesthetic syringe. Okay, so I'm going to show you how to take the carpule out and the needle. Okay, first you're going to disengage the needle, unscrew it, be very careful, and it goes right into the sharps container. We do this in our ops because we have our sharps container right here. Okay, then you're going to disengage the harpoon. You're going to pull back on that spring. You're going to hold back on that spring and take out the carpule. And it's hard with these utility gloves, but it's better to have the gloves on than no gloves. Make sure that rubber stopper comes out of the harpoon, and you want to make sure you grab your carpules and put it into your biohazard container. And that's how you remove this syringe. Okay, so I'm gathering all instruments, disposables, go in the garbage. Okay, all instruments. Hand piece, pull off. And then you get your tray, you cover the tray, and you go into oops, we gotta grab our burrs in there. Then you go into sterilization. Drop your tray. You come back to your room, start taking away the disposable barriers. Whatever hand pieces I used, I put aside. So we used all these. I'm gonna clean those separately. So everything we touched, we're going to wipe down. We use Cavicide. You get 2 wipes. Spray. So we do the spray wipe technique. So we're spraying everything we've used. Be careful not to spray something that should not get sprayed. All right, so I'm going to start over here with all the hand pieces. Okay. First things first. It's like a puzzle. So you're using 2 wipes, so your gloves are not really touching the surface. over to the hand pieces. This is the slow mo piece. Oops. Okay, you see how that fell on the floor? You're not going to pick that back up. You're going to grab another one. Okay. All right. Okay. Make sure you put your pens up. Okay. Pretty much you just wipe down countertop. If anything needs to be restocked, you're going to make sure you restock it before the next patient comes in. Have it all set up so you're not running out of the op while the doctor is working. All right. And last, oh, we don't need 3 bottles in here. Put everything back into place. And again, we do mouth rinses before patients sit. Make sure you clean out the sink. Okay. And now I'm just going to go and spray what I just wiped down for my spray wipe spray.